And if you look at the infographics on the background of that moving visual, it also leads you to some pointers about obesity in relation to lifestyle choices, to the food we eat, and then how we take care of ourselves. And we told you earlier on about the World Food Day, marked every 16th of October by the UN agency, the Food and Agriculture Organization. And the country office, they're doing tremendous work, making sure that all of us are in tune. And last year, we brought you about how safe is the food. Now, this year, we're talking about how healthy diets could ultimately ensure that people lived longer. But also, at the end of the day, we have a great correlation with how we have to end hunger as well. And what a better way for us to mainstream the discussions than to introduce to you some of the great conversationists for us this morning. We have Daisy Ceoncio, who is the Regional Communication Officer for the FAO right here. And thank you for joining me, Daisy.
Good morning.
Yeah, it's a delight to have you. And then also Blaise Ouattara is also a Senior Food Safety Officer of the FAO, Regional Officer for Africa as well. Thank you for joining me.
Thank you very much.
And I know in our contest, when we talk about the officers, we think they are the lower rank. Look, yeah, these are big people. But also, we want to let you in the conversation. And as a result of that, make sure throughout this minutes of conversation, you are interacting with us on Facebook, JoyNews on TV. We also have a Twitter handle at JoyNews on TV, and you can watch us live at My Joy Online TV through our YouTube channel on YouTube. As you do all that, let's begin the conversation in the first place. Let me first ask you, the theme looks like it's become more important because of the related issues we're uncovering in the world, especially also on the continent. Is that not it?
That is absolutely correct. So our theme for this year is Our Actions Are Our Future. There's a certain trend that is going on around the world right now. So it's a little bit of a paradox. We have a huge number of people who are suffering from malnutrition, 820 million all over the world. In sub-Saharan Africa, we are looking at more than 300 million. So at the same time, we have a huge proportion of the population who are also suffering from obesity. So it's quite a paradox. There are a lot of hungry people, but there are also a lot of overweight and you know, it's obese people. So it's a bit kind of a paradox and very interesting. It is part of a nutritious diet that we have to look into. And we're celebrating World Food Day for us to kind of talk more about it on how we can make informed choices, you know, how we can make informed choices when it comes to choosing our food, when it comes to our diet. Also with a sedentary lifestyle, we sit at home so much, our children with the mobile phones. I mean, just going back to obesity, it is coming up. Studies show that we have a lot of non-communicable diseases that are showing up. You have heart stroke, you have respiratory problems, all brought about by the excess weight your body is carrying. But the most worrying thing is our children are picking that up. So they have a higher chances when they get big, when they become adults, that they would be carrying that. It's costing the whole world $2 trillion in terms of the medical costs.
Maintenance, just to maintain.
Just to maintain the medical costs. That money should be going into development goals, but it's being diverted into something that can be controlled by me, by you, by everyone else.
Well, but we also do know that in sharp relation and not contrast at all is how this food is safe for us. And it would mean that there should be a certain correlation between what you have found out by way of your observation, what you're picking on the ground, and what actually should be what the policy direction for countries in the sub-region.
Thank you very much. And I am here to make this link between food, nutrition, and food safety.
Fantastic.
Because we are struggling with a lot of diseases that are due to the consumption of food. Globally, it's 600 million people who get sick by eating food. And when you bring that to Africa, it is almost 91 million people. And from these people in Africa, about 137 will die. So that means it's very important for the policymaker to make sure that the food safety issues are taken into consideration when we plan the global policy for food.
You know, it's a conundrum. At the end of the day, we have all these well-garnished, advertised food, and it's not safe by way of consumption. How do we tend to do the distinction then?
I think it's important first to make sure that we have a very good food control system at the national level, starting with the regulation and going to the inspection principles and also the scientific aspect to provide very good information to the decision makers. This is one thing. And the second thing is also to work with the consumers. Consumers' education is very key in achieving food safety.
I see. But look, we have a glut of fast food chains, etc.
Exactly.
Yeah. And then if you look at how sumptuous the foods are, the way they are advertised, we've also seen that transition into the homes. And so food is cooked with a lot of oil, and we don't tend to care about the nutritional content, etc. Why are we seeing that phenomenon?
It is the urban lifestyle that we have. A lot of rural people have been moving into the urban centers, the cities. We also have the globalization. You know, trade has opened up. So we have an influx of all these Western and other influences, such as the fast food. I mean, me, myself, I stop by at the street markets and, you know, buy the fast food. You have fantastic food here in Ghana. And I don't think much about the nutritional content of the food. So it is part, as Blaise said, it is part of our education. We need to educate people on the amount of saturated fats or sugar that they eat. Also, at the same time, it's extremely important for these private sector, for these companies, to label the food that they are producing and selling to the consumers. Also, part of the safety is to ensure that the fruits and vegetables that are produced from the farmer's level, from the ground level, all the way to the packaged product should be safe. So there's a lot of processing involved. So food safety also touches on that. So yes, going back to your earlier question, you know, why is there like saturation of all these like fast food restaurants? It's also easy for us because instead of me, I'm a mother, I go home, I cook it, I come from work, it takes 2-3 hours for me to cook. Whereas I could just like easily buy food that is fast and it's still hot.
In 10 minutes or 15.
Even less sometimes. So it's the convenience.
If pre-ordered, yeah.
Yes, it's the modern lifestyle that we have right now.
So we have to be careful. But we also needed to draw the correlation between what the lifestyle changes are. Because we're not going to see, or we don't have a lot of the fast foods that could be affordable to the ordinary person. But even what you see over the counter or on the market, how safe is it? We decided to send Derek Ekosam to the lower end of the market belt to get to have an interaction. And also even the market women or traders who sell, do they have any idea about what food safety is about and what they are selling to consumers? Just take a watch. Well, so as we bring you all that, please also know that we have to continue with the conversation. Now, if we'll go to the market, why should we be talking at the end of the day the fast foods and you look at how the food is well dressed? And for us, the local people, we still do know that even though we're not taking the saturated fat foods, etc., we're not taking the right ones and they're also not safe. At the UN, how bothered are you on that?
I think at the UN way of seeing it is that the issue of food, nutrition, it is a farm to fork, meaning that all the activities should start at the beginning, at the farm level, to the end of the chain, which is the plate of the consumer. And what we look at is how the food is handled from the beginning to the end, making sure that all the good hygienic practices are put in place, all the good agricultural practices also are in place, and then consider that this is a chain. and it should not be broken at anywhere. So this is the approach to
and you the big people give us all the knowledge about the phyto or phytosanitary aspect of what that has to be done. How do we make sure that is well regulated and those basic steps are obeyed at the farm gate?
I think there should be a regulation, a very good regulation in place, but also it's important to make sure that some of the key elements in food safety are well understood by the consumers. And I will tell you that we consider basically 5 key elements to take into consideration for food safety. One is to make sure that all the people manipulating food are doing it in a clean space. This is one thing. And then we need also to know that it's important at home, in the kitchen, to make sure that we are separating cooked food and raw food to avoid contamination. And then there is the aspect of eating the food. We need to boil it at the right temperature because the microorganism will be killed if you cook well. And then there is this issue of making sure that when you have food, you need to avoid some zone of temperature because the microorganisms that are making us sick, they also like food, they like water, they like good temperature. So we have to avoid letting them in this good environment in our food. So I mean, if you have a food, you have to put it in the refrigerator, or if you have to keep it hot, you have to keep it more than 60 degrees. These are some of the good practices that we try to teach to the consumer. And it's easy, they don't need to know scientific things about the microorganism. Just some of the good practices will help a lot.
Okay, but let's now return to the market. Derek Akosam with this interaction.
Our actions are our future. That's according to the Food and Agriculture Organization of the United Nations, and it's all in commemoration of today's celebration, the World Food Day 2019. So I'm here at the Malata market to speak to the market women, those we buy the things from. What do they understand by this, and how are they contributing towards a healthier diet as we also work towards a zero hunger world? So come with me on this ride and let's talk to some of these market women. Right, so I'm here to speak to this woman. She sells salted pepper, what we call Kobe in the local parlance. I've seen garlic, I've seen ginger, and then I've seen onions as well. How are you? Any problem?
Oh, me na me hwe so yi. Ne me kodwoma ne ye fine na me to. Nti me ye no chenchene ye fine. Oba obetimi atobi. Ne ma ne boy de omo se Ghana ye de nso. Me come market and ye fine. Me nkoto ne a ye de dry and aye basa o be ba beto no. Me kwa koto no high, me ba beto no me kwa koto no low o me ba beto no high wa ha no. Ni nyina me ye no fine. Omo se ne board me ton na tronic cap eguso kra me fi se fa ne enti ameka sa dachi ye ma ukoto bibi a enye no leta na be ha obi wo beto bibi won chena de ne nya okwa ha ne yam what I say me dibi nti me dibi na say me keeping it clean.
But your friend saying
from Helena Ibonte.
Okay, so that's Helena Ibonte there, and basically all that she's been saying is the fact that when she goes out there to the market to buy foodstuff, she only goes in for the best, irrespective of how much it would cost. She knows that times are a bit hard, but she knows that she has to think of the future and think of those who will benefit and also those who will buy the things from her. So she would not necessarily think about the pricing, but she will think about how safe and wholesome her products are. And you better was say we'll move on and speak to some other people here at the Malata market. So please come with me. Let me speak to this woman as well. She sells one of the meals I like most. There's gari, there's egg. I've seen some beans around. What's your name?
I'm Evelina Kushilamte.
Evelina Kushilamte. How long have you been selling?
For, let me say, 18 years now.
18 years. All right. So when we say that our actions are our future, when it comes to what we eat, how do you understand it?
I understand it like when you are selling, you have to be politely, gentle, dress up nice.
Basically, it's about the things we do that will make the food go bad or make the food stay in a good state. So how do you keep your snails, your beans, or how do you keep them neat?
You see, the snails, they don't like salt. So I maintain it nice so that it will not, maybe when I have Kobe, I can't bring Kobe to the snails because it will die. I preserve it. When I close, I put it in the basket, give them contomere leaves to eat. I close it nicely. The eggs too, you have to preserve. You shouldn't let the sun be on it. And when it's raining, you have to cover it so that when the rain touches, it will spoil. If someone buys, when he go home, will come and tell you the things are not fine. So all the time, you have to keep it nice. And when you are eating too, you have to wash your hands neat with water and soap before you eat your food.
Why is it important to do that?
Because you have to be hygienic so that you wouldn't be sick. Because when you didn't wash your hands neat with soap, you get diarrhea, you get a lot of diseases. When you wash your hands with water and soap, at times we have some of this thing, how do you call it? The one we used to, if there is no water, I forgot the name. When there is no water,
is it the sanitizer?
Yeah, you have to use it, and so that you'll be okay. At times people will eat without washing even their hands, or even when I'm sitting here, I buy food. I'm supposed to wash my hands before it. But when I buy maybe both fruits, I will just put it in my mouth. It doesn't show nicely. You'll be sick. But if you want to be strong and healthy, you have to keep your environment, everything neat. Especially for the women in the market, we have to wash our hands with clean waters and soap, so that we'll keep long life.
Thank you very much. That's Auntie Evelyn speaking to us about why it's necessary for you to keep your food stuff neat and also ensure that your food is safe. I want to speak to this woman as well. Good afternoon. How are you? So, what do you sell here?
I'm selling fish.
Okay. Edentina ehunhia say ye di aduane a eye. Wo aduane a efin bia enni ho.
I said, son of Ben, fine. Son be cleaner. James Bia and room when I be, sir.
It's a ukodwa so na wo koto a den na wo dwe ho a e ma ka se o meto aduane we anase meto nam we finipa we ho.
Me share area no baby and panity no environment no. We share one sana mato.
But you're for saying?
Patching the patients stand on.
Patience. So that's Anti-Patience who also sells some of these fishes you are seeing here, and for her, she says it's a must that whenever she goes out to buy anything, the things she sells, she ensures she buys from a safe environment so that whoever buys from her will be safe. So I have come here as well. When you want to cook, tomatoes are very important to your meals. If you want to prepare salad, if you want to prepare stew as well, you would need this. How are you?
I'm fine.
And what's your name, please?
My name is Aisha.
Your name is Aisha. How long have you been selling tomatoes?
It's my mother who is selling from here, but I'm helping her sometimes.
Okay, so we are commemorating World Food Day. It's all about food. And we are looking at what they say, our actions are our future. The things we do today will determine how tomorrow will look like. For you, as somebody who sells food, what does it mean to you?
It's mean good to me. If you have to, like I'm selling tomatoes now. Tomatoes is what I'm selling every day. It means everything to me. So it's very important to make it clean.
Meto free nipa we wana meto free nipa we ho.
Omo de band there ye ni mo but ye share ne ye wo mu different types ebi wo ho a enye fe ebi na mi mu sesi ayi nti ye hwe mu ye nsa 2 months ye hu se we ye papa na we nye papa.
And I'm sure many of you can relate to this. You're buying the food items and the food stuff on the market, but how safe are they? But more so with the just around you, the replication of having structures of fast food joints, the multinational ones as well as the ones that are springing up locally as well, and the way you cook, that being an influence of what you're seeing on social media and what the advertisements are, and what you think you should also be having by way of lifestyle. What do you do at home? What do you think about the related issues of obesity, etc.? We'll be opening the phone lines, and as you're watching, you can also add your contributions to this. But if we have to continue, Daisy, sure. the way we saw the food items there, sometimes we're consuming and we don't think that it's unhealthy. Mm-hmm. It's something that will not be peculiar to Ghana, I'm sure.
Right, no, it's all over the world. It's a common problem. Where I come from, I'm originally from Asia. We have a lot of street markets and access to food being sold out there. One good thing about it is FAO, we are present in most countries. In sub-Saharan Africa, there's 47 countries that we cover. And we work closely with the governments, also with cooperatives and other organizations, the market sellers, for example, to advocate, you know, like you have to inform consumers on the food that they are eating, but also advocating to our consumers directly. So World Food Day is an occasion that we celebrate all across Africa, all across the world. That zero hunger is not just about hunger. It's making decisions on informed choices, making decisions about our health. So we have to look at certain angles to that. And we're working with governments to ensure that we have all these right information.
And since you're the food safety man on this conversation and also in your office, then it kind of dovetails into the theme, our actions, our future. What actions do you think we need to be taking then as individuals, as communities, as societies, and all together as countries?
I think, as Daisy said, we work closely with the country government. And the first thing that we do is to make sure that the food control system in general is very strong, which means that we will be looking at all the components of the food control system. And then what is also very important is to make sure that there is this dialogue between the regulators, which are the competent authorities. This is the way we call them, the inspectors who are going to make sure that the food is safe. These people need to have a communication channel with the population, with the business operators, because I think it's important to move from the conception that the competent authorities are here to punish. This is now over. We need to establish a true communication, because most of the time it's because of misunderstanding of the issues around food safety. You need to talk to these people. The video I was looking at, we see that these people, they want to do good. They want to be in business for a long time. And they also want to sell very safe food. But sometimes they do not have all the tools. And this is the responsibility of the government. And at the UN, at FAO, our role is to work with the government to make sure that they have this tool put in place so that we can work together for a better world.
But then we mean that with the responsibility that is placed on these institutions you're talking about, we also would have responsibilities as consumers. What should we be looking out for example, whether it's it's a retail store we're entering, or it's just a normal market where they're selling foodstuff and flies and things are all over? What should we be looking out for?
I think when you look at the roles and the responsibility, we have a very big role of the government from the beginning to the market, basically. And then there you also have the responsibility of the food business operators. In fact, they have the biggest responsibility to make sure that the food they are selling is good and safe. And then when the food leaves the hands of the government people and in the market, this is where the responsibility of the consumers come in. And this is the kind of education and the tool that I talked to you about at the beginning. Our responsibility at home is to make sure that we are putting in place these very good practices. This is one thing. And the second thing, consumers have a very big responsibility in making sure that they are putting the necessary pressure on the food business operator, because they need to tell the business people that this is the kind of food we are looking for. And this pressure, I am telling you in a positive way, is not necessarily fighting, but it's letting them know that the kind of food that is good for our children, our people is very good.
So, for example, when I go to the market, I go and tell the market woman, look, your food is not good, so I'm not buying. Is it part of the positive pressure?
It is, okay, you can say...
I'm asking this because you know the way many African markets are, hygienically or for sanitary purposes. The foods already are not being sold in very good environments. The food, by way of the way they're garnished or the way they look, not, well, we think that we'll buy and go and wash, etc. But you look at the physical state of the food, is not good. What responsibility will be on me as a consumer?
I think we have a lot of consumer organizations. My advice will be to work through this organization, but I would not encourage a consumer to go and fight with the street vendor and say, oh, your food is not good. Maybe that will not get to the result we are looking for. But when I say positive, is to have a message, and that everyone understands the message, and then we can channel the message through the Consumers Association. And the good thing is that now the Consumer Association, they are really involved in these activities for food safety protection.
Well, we'll display the phone lines to you. And you as viewers should call us. What do you do in your own home? How do you ensure that your food is safe? But more so, we have all these well-garnished and advertised foods that are sprawling around in our communities. And I don't want to mention the names, but we're told they're not healthy. But it also means that, Daisy, we're developing. You mentioned that earlier. Ghana is even developing. What are the statistics like? Are we becoming more unhealthy in relation to either obesity and subsequently that translating into the high BPs and right, the unsafe health practices that we tend to see?
It is. Ghana is a developing, you know, it's, we've seen a lot of developments. We see all these buildings and all the modernization coming. One of the side effects, I would say, is Ghana has access to all these accessible foods, and some of them, most of them, I would say, is quite unhealthy. And there's also the cultural, we were discussing it earlier, perhaps there's a genetic factor to it as well. But Ghana is indeed in the top 3, the fastest rising obesity rate in West Africa. So it is something that we need to look into. And indeed, you know, our actions are our future. You were discussing what is my role as a consumer. So we had an event yesterday where we had a number of people, a number of young people who went to the World Food Day celebration. And the children spoke. A lot of the students came and they spoke and they said, it has to start from us because our actions today would dictate our future. These are the young generation. And DJ Switch was there and a couple of other, we call them the, we even had the Captain Healthy Diet guy, a little 4-year-old boy. So one of their suggestions is, the decisions rest with you at home. So when we go shopping, for example, when we buy our food, we make sure that we have, you know, we purchase the healthy food. And then there's another kid who said, you know, we have like little plots of land in our backyard. Why can't we grow our little tomatoes, you know, our little garden?
All the lands are becoming cemented.
It's true, but you know, you don't need a lot of land for a tomato. It's a pot that you can give, you know, it's a good start. So we start small. So if it came from the children and they made a commitment that we can do it ourselves, of course adults have more, you know, we should be more committed than them.
And that's why we have the slide. The slide is just asking, what can we all do? And increase our intake of fruits, vegetables, legumes, nuts, and whole grains, limit the consumption of foods that require an excessive use of natural resources such as water to be produced, consume fewer foods and drinks which are high in refined sugars, saturated fats, and or salt. I'll come back and ask Mr. Watara what do we all mean by all that, because Charlie, I drink a lot of sugar drinks every day. Am I in trouble? And many of you watching, are you also in trouble? But that's where we transition and get to open the phone line. Straight away, we already have the numbers displayed on your screens: 03022116911 or 2. Let me just go through again: 03022116911 or 2. And already the phone lines are buzzing. We have John, who is calling us from the Volta Regional Capital. John.
Good morning. Yes, I'm hearing you say.
John, F1.
Hey.
Great. Well, John, please let us know what you want to say. Your contribution will be helpful.
Yeah. Yeah, good morning to you all and good morning to your viewers. Yes, like the topic is very, very important. World Food Day. And I eat food a lot. Let me also take this opportunity to greet my regional minister and my chief director, coordinating director, and all the staff of VRCC. I will not forget the best and best staff of the two regions, that they are doing well, and my national office. My contribution to this program is, yes, how do we preserve food in our homes? What I can simply say is that even reserving food in our fridges is not also the best way, because at times we keep them in the fridge for long. And we keep on bringing the food and warming it and sending it back. It is not of good hygiene. The next one is that we should try to concentrate much on vegetables foods and the natural food. Natural food is the yam, the plantain, which we produce ourselves, and forget of the imported one. In fact, for me, I'll even suggest that majority of Ghanaians, if not all of them, to take our stable food like rice, which we are producing ourselves, and as you come to Volta region, they are the natural food which all of us can easily see on our roadside, which will also be good.
Well,
another one is that even the vegetables we are talking about, in fact, it is not good to leave leftover food and continue to warm it. And this is what some of us do. Even go to the roadside and buy food which has been left over for 2 days and they warm it. We should avoid some of these things from our houses. I can see the picture displayed. These are the food we can be buying and be cooking all the time.
I love the passion with which you speak, but what will be your own mindset? As we also encourage others to also call in relation to all the good things we tend to see around and they advertise the pizzas, the shawarmas, what do you think? What could be the substitutes for them?
Yes, like the pizzamas and all those, like you are just asking me the question. I don't have appetite for those things.
You don't have taste then?
I don't have appetite for those things. Going to stand and buy food, chow with all those kind of cream and all those things, they are not my appetite. I prefer going to a woman who has pearl plantain or yam and roasted it on the street, and I'll buy it and wrap it and get to my office and take it and drink water. So I'll encourage people to go out there, buy the food which the women have displayed.
Okay.
So that at least they will also get an income to be able to live on.
All right, John, thank you very much. Please make sure that you keep calling 03022161691 or 2. And we already have Janet also calling us from Kumasi, the Ashanti Regional Capital. Janet. Jane?
Morning.
Yeah, good morning.
Good morning.
And the conversation has now brought the whole debate about what do we do. We're developing as a country. We have all the malls, all the food joints, and even locally we have the checks and things. And you know, the way they fry it, you get to find out even you, the women also, and the wives at home, you keep frying sochi and all that. What do you make of it? The food choices and the healthy living?
In fact, I'm very, very grateful for this program. And hello?
Yeah, but please continue. We're listening to you.
I'm very, very grateful for this program. But my worry is, of recent, there is these social media videos going around with plastic or rubber cabbage. You see some white people using plastic or rubber to prepare, make a cabbage. And when you see it on the video, compared to the natural one outside, there's no difference, as well as eggs. So when you go to the market, now you don't know which is being made from those plastic ones, and which is being made from the natural, which is the natural one. So this is my worry. And the chemicals in the food, attached to buy some lettuce, and you can even smell the chemicals spraying on them. And if you are someone who don't have the sense of smell, you buy it, and then you go and eat it, and then it has some effect on that. So let's think about these things.
Okay.
You still have to prepare fruits and all those things.
Yeah.
Thank you very much.
Well, thank you too. And we'll go to Weja. Ajimai is on the line. Ajimai.
Hello, good morning.
Yes, Ajimai, you've been listening so far or watching. What's your contribution?
My contribution this morning is today is World Food Day, and we have to think about Sustainable Development Goals, which talks about no hunger. And it's a problem now. We have to make sure we don't get hungry as Ghanaians. We have the land, we have the resources to make our people not get hungry. So we should actually let people know and let the government put things in place to make sure we don't get hungry, because it's part of our achievement as a people. It's a UN Sustainable Goals, it's SDG goals. It's very, very important. And the government has to put in policies.
I agree with you. I agree with you. Yeah. It's quite a conundrum. We say that we want to be food secure. At the same time, we also have food that is making us unhealthy.
Right. It is. It's a paradox that we're talking about. It's like threats to malnutrition. When you're malnourished, your body is actually hungry, right? You're not getting enough nutrients.
Even though your body is okay.
Yes, I mean it looks physically,
yeah.
but you know it's breaking down. You have heart problems, you have respiratory problems, psychological problems. And I just want to go back to Weja, that call about the Sustainable Development Goals. It's number 2. It's SDG number 2, which is zero hunger. But it also allows us to think: do we have enough time to reach these goals? We have 2030. Africa, which is the Malabo goals, is even earlier. It's 2025. So we have to work closely with the governments. We have to work closely with all our stakeholders and partners to ensure that we are on track when it comes to timeline. And then something just struck me with what John said about, our refrigerator is there, we keep reheating food, and perhaps Blaise can talk more about it. I just wanted to emphasize that we have indigenous foods that are available. There are 6,000 species of food that we only use maybe less than 10%. So in the Sahel region, for example, there's a variety of plants and other vegetables that are not currently being utilized. So we had an event yesterday where we had Chef Ado who came, and he was purely cooking indigenous healthy foods. Local foods. So that's
we call local. Local food.
Sorry.
Local. You use a local. We use local food. Yeah. Local food. Okay. But then you have other programs you're using to mark the period.
And that is correct. So we had an event yesterday, which was a pre-event World Food Day. World Food Day is actually today, and there's a celebration happening at the State House. And then tomorrow we're going to have Seed to Salad, which is a demonstration of public schools kids who are going to be celebrating with us on...
In Ghana's public schools?
Yes,
the correct. Real public schools, or the public school behaving like private schools?
Everyone is welcome. Yes, so it's going to be at Independence Square. So we're going to have a couple of celebrities who will be there. DJ Switch is going to join us as well as Kwame Eugene. And then on Friday we're going to have a walk around the FAO RAF, the regional office, which is next to Kempinski. We're going to walk around and then we'll end up at the Children's Park. Please join us. We're going to have market vendors who will be serving healthy foods, and we're going to have plenty of students who will be joining the fun. And we need, they will be emphasizing how our actions today will dictate the future.
Okay. Well, after this event, we'll still have to continue with, we have the program of action and all the pacts we have to ensure that as country we mainstream. Are we at risk of artificial foods and also genetically modified foods as well, creeping or perhaps, well, invading our markets? And consumers, are we at risk?
I think this is
it's been a big debate.
Yes, it is, and it is an issue that is not only for Africa; it's worldwide. So as we are developing, there is a lot of change in the food that we eat, and definitely we will be facing these new approaches to food and nutrition. So what we have to do is to make sure that we are taking that into consideration, and also making sure that we are bringing the scientific knowledge and the risk assessment and of all these novel food to make sure that every time the health is protected. And Ghana, I think, is going very well, and we are working with different government institutions in Ghana, like FDA, Ghana Standard Authority, to make sure that Ghana is also taking part of the global discussion on food safety regulation and so on. Yeah,
look, I've enjoyed this discussion. It's been educative, and invariably, indirectly, they're only telling me that my pizzas and my shawarmas, I should make sure that I substitute all the things that are not healthy for my body with local things that are very healthy. I'll try and do that, a lot of herbs and all that. But look, the conversation has been very greasy, made possible because I've had good discussions from the UN office, the FAO office right here, and I've had the regional FAO communication officer, Daisy Ceoncio. Thank you.
Thank you.
Yeah, and then also Blaise Ouattara is the Senior Food Safety Officer of the FAO Regional Office right here for Africa. Thank you.
Thank you
very much for having us.
And we'll have to end the conversation. We'll bring you a conversation on, you know, they just started or ongoing bank case. We'll do that very soon. But please, I have to leave you with this. That did you know that we have over 800 million people suffering from hunger? It's well, Daisy will tell you it's a paradox. But we also do know that about 149 million children under 5 are stunted, while 49 million are affected by wasting. Unhealthy diets combined with sedentary lifestyle, like us, you know, always in the office and not jogging, not exercising and doing that, are the #1 risk factor for disability and death from non-communicable diseases. We all should be afraid. On the side, environmental damage caused by the food system could increase between 50 and 90% in low to middle income countries, and this is due to the increased consumption of processed foods and meat. Ghana is found somewhere in the low to middle income countries, so don't think that we're secluded. And also, health problems linked to obesity costs, they inflate national budgets worldwide, and currently it's estimated at $2 trillion in treatment each year. Even for Ghana, I don't know whether we're even thinking of the cost, because in West Africa, the obesity rates, we are second to Nigeria. Just think about it. Are we thinking of the cost in the future, in the immediate future? On the side also, some 6,000 plant species have been cultivated for food throughout human history. And today, only 8 of them supply more than 50% of our daily calories. And Daisy will stress on that and say that we have more locally based plant foods that we need to consume that we're not. So please, I'm not saying you should go into the forest and go and look out for it, but look, make sure that you do. And then as we continue with the statistics, some 600 and 70 million plus adults and over 120 million children, boys and girls, are obese. You can find them in our schools. Your children are all chofu. 5 to 19-year-olds, you see them chofu. They don't exercise. They are holding iPads, video games. They are staying indoors, and it's unhealthy for us as parents. Please, we should be warned. The UN is this is a hazard, hazardous warning. Now, if we move on, different forms of malnutrition can coexist within the same household and even the same individual during their lifetime, and can be passed from one generation to the next. Hey, father to children. Now, what is even daunting is that we have climate change all around. You know, it's now raining each month of the year. We should be worried. Make sure that you visit myjoyonline.com. We have the various handles we have on social media. Joy News on TV, on Facebook at Joy News on TV, on Twitter, and My Joy Online TV on YouTube to get all the updates. This will be uploaded on our YouTube channel. Go and watch it. Think about what you eat. And also go to the FAO website and get all the latest updates. I've enjoyed the conversation so far. But we're bringing to you what you need to know about the ongoing banking crisis court cases. It just started. Capital Bank, Atuesian, and all those infamous people right in the middle of the trial. Stay with us.